Hello, have you been considering a breast reduction surgery, but you're not sure what the scars will look like? You have done your research and you've seen so many different types of scars, and you don't know what scar you might end up with. I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center, Bangalore, and today we will talk about the scars after a breast reduction surgery. Now, firstly, what is a breast reduction surgery? A breast reduction is a surgery done to treat extremely large breasts. When you think of plastic surgery, you usually think of breast augmentation, making breasts bigger. But breast reduction is a surgery that is required by many women. In a lot of women, when the breasts are very, very large, they have bad neck pain, shoulder pain, back pain. They have body image issues. They have unwanted attention. They're not able to find clothing properly. For all these patients, a breast reduction is the answer. In a breast reduction, one, we're making the breast smaller and less heavy and thereby improving the symptoms. But also, two, we're improving the shape of the breast. We're giving a nicer looking breast, and this involves a lift. Every breast reduction is also a breast lift, where we're bringing the nipple up and giving a better shape to the breast. You can click on this link to see our detailed video about what exactly happens in a breast reduction surgery. Now, coming to scarring after breast reduction. To understand the different types of scars and what scar might be required, this image shows the important point. The main thing is where the nipple is. The nipple should be at the level of the inframammary fold. The inframammary fold is where the breast comes up and meets the chest wall. So that is the level at which the nipple should be. Typically, the large-breasted woman, the nipple is much below this. And in these women, we have to lift the nipple up. So now let us look at the various types of scars. This is the first type of scar, what is known as a periareolar scar. Here the only scar that is present after surgery is just around the nipple. This works when you don't require too much of a lift. When you just need to bring the nipple up by around 3 centimeters, then this scar will be enough. But in a lot of patients that won't be enough, so you need to be careful in choosing the patient. If you require a bigger lift, this scar simply will not be enough to give you a good result. Now the second scar, what you see here, is what is known as a lollipop scar. Here you have one scar around the nipple and you have one vertical scar running down below that. So it's called a lollipop because it looks like a lollipop. This is the scar that is used in the vast majority of breast reduction patients in our center. Here the advantage is that you're giving a much better lift. You're able to lift the nipple up to where it should be and thereby you're giving a very good shape. The trade-off is that visible part of the scar that runs vertically downwards. That does fade with time and it becomes less and less, but it will never be completely zero. This is the third type of scar, what is known as the anchor scar. Here you have one scar around the nipple, one vertical scar running below that, and another horizontal scar in the inframammary fold. Hence the name anchor scar. This is required in very large breast reductions. Typically we do not use them because in many patients we're able to give the lollipop scar. The horizontal part of the scar, while it's not very visible, it doesn't affect how the breast feels. And for that reason, many women do not like it. So we only use it when it is really required. Now, if you've done your research, you might have read about something called a free nipple graft. This again is done in very large breasted women, but you only have a scar around the nipple. How is that possible? This is because we're literally detaching the nipple, taking it up and sticking it in place. This is required in really large breasted women where there is simply no other choice. But it is not preferred because it does affect breastfeeding and does affect how the nipple feels. But in some cases it would be required, but not very commonly. So this was about the various types of scars after breast reduction surgery. To know which one works for you, we would have to see you in person and examine you, and then that will help us decide. As I said, in most cases the lollipop scar is enough. In some cases we are able to just do the periareolar scar. Now even the lollipop scar, people might say, oh, what is the point of this? Why should I have that scar? It's a question of scar versus shape. The trade-off is the scar, but you're getting a much better shape. For this reason, this surgery is one of the most gratifying procedures I am able to perform. The patients are always very happy and they say that literally a load has been lifted off their shoulders. Let us see some of these patients now and see the results. So as you can see, when well done, the scars are more than worth it. The patient is able to live a better life, they're able to find clothing that fits them, they're having less unwanted attention, and they have much better body positivity. The trade-off is that vertical scar, which we are able to fade and make it as less as possible in most patients. I hope you enjoyed this video. If you'd like to get in touch with us, our information is on the page. Do like, share and subscribe. Do let us know in the comments what other videos you would like us to make. Thank you. Have a great day.